Hello, excuse me, sorry. My name is Jennifer Yates, and I'll be talking about my capstone reflection video and the intervention done with my patient. My patient, will call him Billy. Uh, I met with him a total of 4 times. The first 3 times were 2 hours each, and the last time was 3 hours. On the final day, we went over an intervention plan to help him manage his type 2 diabetes and prevent other health conditions from happening related to his diabetes. Um, I also met with his daughters who were there every once in a while while I was there because they helped take care of the patient. So, the problem with the patient is how is he able to self-manage his type 2 diabetes. He's a 91-year-old male. He lives alone. He does, of course, like I just mentioned, have his daughters who come and assist him. He is still able to drive, but not too far, and he is able to walk. He does not use any kind of assistance devices or anything like that. He has been hospitalized twice within the last 6 months due to one COVID-19, and ended up having a small bowel obstruction at that time, and then he ended up getting another small bowel obstruction that needed surgery. Both times he needed the physical therapy and coordination of care from the acute care setting to rehab facilities, and then be able to get him back home and functioning like he normally would. The reason why I chose the topic about his diabetes is because whenever he has issues or managing his diabetes can cause other healthcare related problems, right? So, doing the research on type 2 diabetes for the capstone problem and intervention, I was able to find scholarly articles that were written by researchers or nurses and providers within the last 5 years to give me data that was evidence based so that I could be able to implement the necessary information along with the Center of Disease Control and Prevention and the American Diabetes Association to help my patient be able to manage his diabetes. Now, the patient said he does take medication at home for diabetes management. After COVID, he was on some steroids and stuff, so his blood sugars were elevated. But then this last time, he's lost weight. A significant amount due to the last small bowel obstruction and having the surgery. So he was going to see his primary care provider to obtain new labs for his hemoglobin A1C. And of course, he checks his blood glucose maybe once a day, but I talked to him maybe checking it twice a day to make sure that he's maintaining good glycemic index control. Now that since he's lost weight, his numbers seem to be doing better, but it wasn't because of diet, unfortunately. Prior to that, he just eats what he wants when he wants. And so we talked about changing that lifestyle now that he's lost weight to keep that weight down to manage his type 2 diabetes. So we talked about healthy meal choices, vegetables, certain types of fruits, because certain fruits can be harmful in large consumptions for diabetics. And then a source of protein to maintain his sugars and carbohydrate level in his body, right? So I also talked to his daughters about helping him achieve these goals. They do help him grocery shop, and then he has home health that comes out. Now, he does have insurance, so he also has a little helper that comes out twice a week to help him do like little chores around his house. He has Medicare, and he also has a VA benefit since he was a veteran. So those two benefits can really help him. Not all patients are able or lucky enough, I should say, to have those. It was alarming to find that some in the research that I was doing up before 2010 with the Affordable Care Act, that many patients, especially diabetic patients, so let's just say we go back, 30, almost, 15 years now. And before then, diabetic patients had a hard time getting insurance, period. So if Billy would have been diagnosed back then, would he been able to qualify for his insurance if he was under a certain age and not being able to access his VA benefits at that time? So there's different scenarios that have changed for the better of all Americans due to new laws in place. Now, since he is 91 years old, he does have an iPhone, so he is able to operate a smart device. We talked about, does he use a continuous glucose monitor or a smart glucose monitor or any smart pens? The medications that he does take is metformin, and he does use insulin, but only when necessary. Most times he's able to manage his type 2 diabetes with just his metformin. His type 2 diabetes has caused him to have neuropathy. Excuse me. My allergies are killing me. And so for his neuropathy, he takes gabapentin. If he doesn't take his gabapentin, he says he stays awake at night in pain because his legs hurt so bad. So he does make sure that he takes his gabapentin. And he told me that he also uses this little machine that he puts his feet on, and it vibrates and shakes his legs to help increase that blood flow back up to help reduce the pain. He says he uses it every single night, and along with the gabapentin, he's able to maintain his pain from the neuropathy in his legs. He is hard of hearing, a lot of side effects from diabetes, so vision impairment, more prone to infections, hearing loss, kidney failure, heart disease. So all of these contributing factors with him. He does wear glasses. He is able to see really well with his prescription. And then he just got a new set of hearing aids, he told me, that are able to link up to his phone. So he's able to hear people better when they call him and talk to him on the phone. And then he's just able to hear better in general because they're a better quality. So I was impressed to know that he does have that to assist him. Now, we can relate that to how well does the patient how well is the patient cognitively, right? So if a patient is receiving education from their nurse or their primary care provider, how well are they hearing or understanding what you're saying to them? How are you educating them, right? So on a patient like Billy who's hard of hearing, we want to make sure that the information that we're educating is being relayed and understood by the patient, and of course they have family available that helps them. So it is I made a brochure for the intervention to show Billy, since he's able to see and read very well. Since he doesn't hear all the time as well as he would like. So having talking and going over the brochure, and then him being able to go back and look at that on interventions on how to prevent type 2 diabetes or control type 2 diabetes, resources from the American Diabetes Association or the CDC, and some local community resources, there's community centers in his little town that he lives in that offer activities, or there's a park that he can go walk in. Now, he is very active for being 91 years old. He walks around his little property and does little tasks here and there. Of course, if it's a big task, he doesn't do it by himself, but for the most part, he is fairly active. He goes to church every Sunday, and he meets with some of his friends who are also older every third Wednesday to go drink coffee. So he does move around, and he has a good support system with his friends and family to help him manage and control his diabetes and to help prevent him from getting sick. Um, some of the challenges that can happen from elderly patients and family members contributing in their care is you have to wait on your family to be able to go and do things, or you have to wait on your family to get to the doctor, or to bring in your medication if you don't have it, and things to that. So not being able to just really go out and get those things yourself can cause some issues. And also like family dynamics, like, is everyone getting along? Of course, like, not no family's perfect, but at least they can try to get along, right? And then, like, is the patient and the family members on the same page as far as treatment regimen? And then the care coordination from the primary care physician, the home health group, the VA assistants, and the family and the patient. Are they all on the same page to ensure that the patient is being properly cared for, and is he on the best treatment plan for his condition? So, I feel like the intervention to help Billy manage his type 2 diabetes will be beneficial, just because being able to educate and show him. And then also, I watched him take his blood sugar, so I was making sure that he was doing it appropriately, right? When educating in as nurses, we need to ensure that, especially I'm from Texas, so in the Texas Board of Nursing, the code for diabetes and delegation, especially to a non-licensed personnel, is ensuring that they know how to properly administer or draw up a medication. So I made sure that he knew how to check his blood sugar, and then I made sure that he knew how to draw up and check take his insulin when he does need insulin. Now there's technology out there, so the glucometer that he uses, it does collect data. He doesn't use a continuous glucose monitor, though, and he doesn't have a smart Bluetooth insulin pen. But I did talk with him about that to see if his provider would think that that would be necessary. But since he's able to control his type 2 diabetes right now with his metformin and his recent weight loss, it's not necessary at this time. And of course, if something isn't necessary, then the insurance will likely not approve it. So that's another issue that I ran across when doing research for the Capstone project, is that when a patient with type 2 diabetes, or a patient period, is able to manage their diabetes with diet, exercise, and the medication that they're already on, the new prescriptions or new technology that comes out is not easily accessed through insurance approval, because they see that, of course, when new technology comes out, it costs more, and they see that you're able to maintain and manage your diabetes at a lower cost to them, so they deny you the newest technology. And he has a history of gout, and he's had like 3 or 4 flare-ups, he told me. So when he gets his gout flare-ups, he gets really concerned, because he fears that his diabetes, especially when he was heavier and not eating right, he would have more significant gout flare-ups. And being diabetic and having gout flare-ups is not fun, and it just caused more health-related problems. He does go see his primary care physician like every 6 months or so, and then if needed, they're able to get him in for any other health issues. he was getting home healthcare physical therapy 3 times a week up until last week. He, I guess, graduated. He was able to pass the physical therapy evaluation. So he's no longer getting home health physical therapy. He just has a little helper lady from the VA come out, and then he has a home health nurse that comes out every 2 weeks to check on him. Um, so those are the interventions that I suggested is watching what he eats, keeping the weight off that he lost due to his recent surgery, and checking his blood sugar more often just to ensure glycemic control index, because like if he's having an up and down on his sugars, then that's not properly managing his diabetes. And going up and down can also affect your hemoglobin A1C. So we want to make sure that he's not going too low with the medication of prescription that he has for his metformin that is not too strong now, since he did lose weight. If he started having hypoglycemic episodes, and I did ask if he knew like how to tell, or and I educated him on the signs and symptoms of what a hypoglycemic episode feels like, and what signs to look for, and then also with a hyperglycemic episode. So these are all necessary education that was provided to the patient, and to the family. When talking about reflection of Capstone, I was able to integrate all of the information from assessment, actually throughout the whole program. A lot of the topics and the researches that I did for each class covered diabetes. Some of it covered stroke, but for the most part, it was diabetes. And so I was able to use information gathered and evidence gathered throughout the whole program, and then, of course, here in Capstone, to help me integrate this plan of intervention for my patient, and to hopefully positively affect him and his family, so that they do not have any diabetic complications. And so, yeah, if you have any questions, please let me know, and thank you for your time.